Canine Parvovirus is a highly contagious viral disease of dogs that commonly causes acute gastrointestinal illness. The disease most often strikes in pups between 6 and 20 weeks old, but older, unvaccinated animals are sometimes also affected. A rare variant of the disease may cause myocarditis, an inflammation of the heart muscle in neonates. Virus is spread via feces and transmission is by the fecal-oral route. The virus invades rapidly, dividing cells of the lymphoid system, the intestinal tract, bone marrow, and the myocardium. Factors such as age, stress, genetics, and concurrent intestinal parasitism influence the severity of the disease. Dobermans and Rottweilers have a greater likelihood of severe disease than most other breeds. Affected animals may become febrile and lethargic, followed several days later by anorexia, depression, vomiting, and bloody diarrhea. These animals quickly become dehydrated. Puppies can become hypoglycemic and hypokalemic from lack of nutritional intake. The main diagnosis is by a positive fecal ELISA test for the parvovirus antigen. A CBC is also important because of the viral invasion of the bone marrow and lymph system. A profound lymphopenia and neutropenia will impact the blood work, as well as an increased PCV. Serum chemistries might also be ran to check for hypoglycemia, hyponatremia, metabolic acidosis, and hypokalemia, as well as a fecal examination to rule out intestinal parasites. Since the disease is a viral infection, there is no real cure for it. Parvovirus treatment is focused on curing the symptoms and preventing secondary bacterial infections. Intensive therapy and system support are the key to recovery. Intravenous fluid and nutrition therapy is crucial in maintaining a dog's normal body fluid after severe diarrhea and dehydration. Antibiotics may be appropriate therapy for a dog suffering from parvo, administered either intravenously or as injections to help fight the infection if intestinal bacteria have entered the bloodstream. In addition, antiemetics such as Reglan to control nausea and diarrhea can be very helpful. More treatments might include non-steroidal anti-inflammatory drugs for pain, but used only in well-hydrated patients. Nutritional factors is also very important. Partial parenteral nutrition until the patient remains 24 hours without vomiting. The survival rate in dogs is about 80 to 90% with proper treatment, but death may sometimes result from severe dehydration, a severe secondary bacterial infection, bacterial toxins in the blood, or a severe intestinal hemorrhage. Prognosis is lower for puppies since they have a less developed immune system. It is common for puppies that is infected with parvo to suffer shock and sudden death. Vaccinations is the best preventative measure. Clients should avoid exposing their pets to other animals until their pets have established firm immunity between 18 and 22 weeks of age. Yearly boosters are recommended, and for high-risk breeds, a booster every 6 months may be required. Canine Parvovirus is a relatively new disease that appeared in the late 1970s. It was first recognized in 1978 and spread worldwide in 1 to 2 years. The virus is very similar to feline panleukopenia. They're 98% identical, differing only in 2 amino acids.